All right. Well, welcome everyone to the PFCC Partners monthly workshop. It's so great to see so many participants for our workshop today, and I really appreciate all of you taking the time to join us for our really exciting discussion. I'm Lindsay Galley. I'm the Director of Education for PFCC Partners, and this month we are really looking forward to our discussion with Tiffany Jean-Manette, who is the Director of Policy and Equity at the Louisiana Public Health Institute. We believe that every person deserves the opportunity to live the healthiest life possible, and we will hear today how Tiffany has worked to support communities and community-based organizations to create those opportunities and advance health equity. And I know we are all probably very much used to Zooming these days, but just a few tips for our workshop today. Please use the chat as much as you would like. I see lots of folks introducing themselves on there, so thank you all for sharing who you are and where you're from. If you have any questions for Tiffany throughout today's discussion, please put them in the chat box. We have lots of time for Q&A at the end of our discussion today. We're going to kind of have an informal discussion, Tiffany and I, to learn about her work to focus on health equity in Louisiana and learn some best practices as well. I really appreciate all of the questions that came in through registration, so we'll bring some of those questions up, but if you have any others, please put them in the chat box. If you have any background noise, you can mute yourself by finding that toolbar on your screen. If you hover over, I believe it's the bottom of your screen, you can find the toolbar there with the mute button, also the video button, and the chat. If during our Q&A at the end of the session, you would like to come off mute and speak up, you can raise your hand if you can find the little blue raise hand button. If you click the participant list on that toolbar as well, there should be a little blue hand that says raise hand, and we will be able to see that you would like to come off mute and speak up. If at any time you have any questions about the technology, please put those in the chat as well. Really quickly, before we get to our discussion, I just wanted to introduce PFCC Partners and go through a few definitions. So PFCC Partners, we are a patient-driven organization. Each one of us serves in the role of patient-family advisor, partnering with the healthcare system, anywhere from our local health systems to national partnerships as well. And we utilize those experiences as advisors to support the partnership of healthcare providers and patients and families, and really help to grow and empower patients and families, because we know that that partnership is really where health outcomes happen. And before I invite Ms. Jean-Manette into our discussion, I wanted to go through some quick definitions, because in thinking about community-based organizations and supporting community partnerships, I really see them as a way to help remove barriers within the healthcare system. And so PFCC Partners, our organization, has been on a learning journey too over the last 6 months or so since the murder of George Floyd, and have really focused on how we can create more opportunities and get to a place of justice for all patients and families, where we do not have the barriers, the systemic barriers to access really high quality healthcare for every single patient and family, which is why I was excited to learn about the work that Ms. Jean-Manette was doing to really remove some of those barriers and support communities in accessing healthy habits and healthcare, and just focusing on how we can create those good health outcomes for every single patient and family. So moving from a place to equality where everyone has the same benefits, through equity, to everyone getting to the supports that they need, to finally justice, where those systemic barriers are removed and we all have that equal access to healthy lives. And just really quickly, I wanted to describe community-based organizations. Community-based organizations, they work at a local level to meet community needs and can include social service agencies, nonprofit organizations, neighborhood groups, recreational groups, or other special interest clubs. But why are they important? Because they are really important. They have provided social services and care to people of all ages and their families to address community resource needs. They promote health and behavior change and improve functional ability and reduce social isolation as well. What we have found is that community-based organizations also have established trust already with community members who tend to lack trust with healthcare for quite valid reasons as well. And so with that, I would like to introduce Tiffany Jean-Manette. Tiffany is the new Policy and Equity Director of the Louisiana Public Health Institute, or LPHI. Looking over her resume and job experience, you can notice a theme. Louisiana is really part of the title of most of the organizations that she has worked at. She has a purpose and passion for serving her state and has found herself most interested in capacity building focused on leadership and community empowerment. She has most recently served as the executive director for 504 HealthNet, which is a nonprofit established in 2008 post-Katrina to improve access to community-based primary care and behavioral health services across the greater New Orleans region for everyone, regardless of their ability to pay. Tiffany also serves as a part-time organizational development consultant for the Centers for Disease Prevention and Control Office of Smoking and Health. Previously, Ms. Jean-Manette served as the Director of Health Policy and Governmental Affairs for the Louisiana Primary Care Association. And from 2012 to 2016, she served as the Gulf Region Health Outreach Program Primary Care Capacity Project Manager with Louisiana Public Health Institute, where she led the design and implementation of the program and provided tailored technical assistance to FQHCs in Mississippi and Florida. Ms. Jean-Manette is certified in project management professional with over 13 years of experience in public health programming that includes strategic partnership management, health equity, and healthcare system transformation. She earned a Bachelor of Science degree in microbiology from Louisiana State University and a Master's of Public Administration concentrating in nonprofit organizational development from Louisiana State University's E.G. Orso College of Business. Ms. Jean-Manette, it is an honor to have you join us today, especially with all of the recent unfortunate hurricanes happening in Louisiana, and I know you have some weather there right now, so we are honored to have you join us.
Much, Lindsay. Yeah, sorry, I hope the thunder doesn't become a distraction.
No problem at all. We really appreciate you taking the time, even with the weather, to join us. So to start out, can you just tell us a little bit about the work that you've done with the 504 Health Foundation and kind of moving that through to your current role at Louisiana Public Health Institute?
Sure. So 504 HealthNet, as you read, it is targeted for the greater New Orleans area. It is a membership organization where we have 35 healthcare organizations from the FQHCs to the largest hospital safety net system in the area who come together to do collective impact programs. So 504 HealthNet serves that membership group with community outreach and engagement, connecting community members to their services within the safety net healthcare system, as well as a lot of advocacy for the collective. So if there's an issue at the state or federal level And as a group, it's a priority. File for Health Net would advocate on their behalf. And then we did a lot of training and capacity building events for the providers, front desk staff, for those healthcare organizations.
Great. Thank you.
Yeah, and so now, sorry,
Oh, no, that's
so
okay.
at LPHI for 6 weeks now. And so I'm going from that local grassroots level to a statewide nonprofit. And LPHI was set up over 20 years ago to be that non-governmental partner to the Department of Health's Office of Public Health, because there's a lot of things that the Office of Public Health couldn't do, like advocate on behalf of certain public health policies. And so LPHI was set up to be that partner to do that. And so we've grown over the 20 years to now having over 70 different projects that we do across the state. And we do have the Louisiana Campaign for Tobacco-Free Living, which is a tobacco prevention program that receives some funds from the cigarette tax to administer prevention and control programs across the state. That program, because it's our most resourceful, has staff members that's actually placed in every region of the state.
Wow. Wow. So really getting down to those local levels, that's so important. So can you talk a little bit about how you used data to identify issues within the community?
Sure. So I'll use the example from the Gulf Region Health Outreach Program. When I was at LPHI 5 years ago, it was heavily community data driven, and that LPHI received $50 million as part of the settlement with the BP oil spill that happened in 2010. And so we really had to design a program from scratch to figure out how we would administer that $50 million to become community benefit for the communities from Louisiana to Florida. And so, of course, we went straight to the community data that was available to figure out what are those health needs and outcomes across the Gulf Coast. So we use a lot of the community health needs assessments that were already done and published, and then worked with other entities like the other public health institutes across the Gulf Coast to identify what other resources were there as far as secondary data. And we started to develop community profiles for each of those regions. And we were able to get down to some of the parish and county levels. And from developing the community profiles, we were able to go back to the community and community forums and say, this is what we see. This is what we have based on what's published. Is this real? And so it opened up a dialogue with the community members to say, no, that doesn't seem right, or y'all should look into this. And that document became like our attention grabber to start the conversations with key decision makers in the community, as well as those community advocates. So community data is definitely, that foundation for anything we would do after that. And then at 504 Health Net, the one thing we ensured we did before we started any project or program was do listening sessions with our community members. So identify community members who wanted to talk about the issue, and then set it up at a convenient time for them. So we started to host dinner parties for like our community members that were hospitality workers, and got them to come. And it was facilitated, but it wasn't high pressure, high stress, because you're eating, just chatting, but we knew exactly what answers we were trying to get from them. So we had our questions set up to really get to have a intentional conversation to get the data we needed that informed our programs.
That's really interesting. And I like how you actually shared the community profiles with the community to really make sure that you were understanding those community needs from the voices.
Sometimes the data doesn't capture everything. And sometimes, there's a few instances where perhaps what we found wasn't correct, or, from the community's perspective, they would disagree that, tobacco was the number one issue. Maybe they said, we think obesity is the number one issue, but the data says tobacco is.
Right.
And so it just helps to have that conversation.
Absolutely. And so you mentioned that you identified community members who would be interested in being a part of those conversations. So how were you able to identify those community members who wanted to have their voice heard, who wanted to inform the work that you were doing?
So I think that our approach, I'll call it it was the snowball effect. So you identify that one person, and it could be your friend, it could be somebody in your network, and you're identifying the network or group based on what your outcomes are. So for us, I'll use the hospitality example. If we knew we were trying to do something for the hospitality workers,
Mm-hmm.
it needed to be within that network. And so just using one general manager from a restaurant, having that conversation, letting them know what we're trying to do, and then tapping into their network, asking them, is there 2 or 3 people you think would be interested in talking with us? And then just snowballing. And you could do, you could do that based on any topic that you have.
Right. Right, absolutely. But establishing that one connection so then you can kind of have a foot in the door per
Yes,
se.
yes.
Awesome. Well, so in thinking about now community-based organizations, we really think that CBOs have the best knowledge of what those issues are within the communities and also the skills to help find those solutions too. So what is needed to empower community-based organizations to be able to collaborate with health systems for healthier communities?
So most CBOs are grounded in the community. They have people who are either the leaders on the board or staff members within that community. Um, but I say after now have run a community-based nonprofit that
Mm-hmm.
the resources are lacking for CBOs,
Mm-hmm.
and the system, it felt like the system of nonprofits is not set up for the greatest success
Mm-hmm.
for CBOs. So whenever an entity wants to work with CBOs, is just being mindful of the struggle, because I don't know of any CBO who feels like they have the best budget and have
Mm-hmm.
all the resources that they need. And usually because you're a local trusted entity, you have everybody trying to work with you or ask you something or get you
Mm-hmm.
to do something, but not showing you their resources or not providing resources for you to get that work.
Mm-hmm.
And so the way the system is set up is you end up kind of being the jack of all trades because you're being asked to do so many things from the community perspective, your board, others, but you're not getting the necessary resources you need to do that. And so it's always a struggle. And so any group trying to work with CBOs, I think just being mindful of, CBOs being a nonprofit entity and the
Mm-hmm.
struggle that they have to go to get their mission accomplished. And I bring up resources. I feel like overall with the system, with racism, institutional racism, it comes down to 2 things: power and resources.
Mm-hmm.
And so I use that lens in talking with legislators and thinking about strategizing with legislators, leaders of organizations. It's always about power and resources. And then with public health, our most vulnerable population are the ones without power and resources.
Mm-hmm.
So I feel like throughout all of my positions at a Louisiana organization, it's been me trying to be a connector. So identifying where the power and resources are and
Mm-hmm.
try to get them as close as possible to the vulnerable populations or
Mm-hmm.
those who are serving them. And it's usually the CBOs.
Right, absolutely. So where do some of those resources come from to support CBOs?
Um, Philanthropist,
Okay.
governmental entity, because I first started off working in state government, going to 504 Health Net, it was actually one of my missions to not rely on a state government contract or federal contract, just
Yeah.
because I know how long it takes and it's not conducive to you actually being able to be flexible and agile and do what you need to do.
Mm-hmm.
So as a CBO leader, I actually tried to avoid the governmental contracts. So we relied heavily on philanthropists, the local foundations, national foundations. And then, when it came to like our hospitality worker project, thinking about who also is a leader or resource, a group with power and resources for hospitality workers. And for
Mm-hmm.
us, that was the New Orleans tourism industry.
Mm-hmm.
So we went straight to them and built that relationship and show them how ultimately they should invest in the health of the hospitality workers if they wanted a strong tourism industry. And so as a CBO, you really have to be strategic.
Mm-hmm.
I understand what your resource needs are and then strategize as to who has those and why they would want to share those with you.
Mm-hmm. Mm-hmm. That makes a lot of sense to me. And another thing I was thinking as you were talking about using the community health needs assessment as well, because I know health systems utilize those needs assessment to then develop implementation plans or strategies to support the community. So is that another way that health systems can then support those community-based organizations by using what they find in the CHNA and supporting them through their implementation strategies?
Absolutely.
Mm-hmm.
And I actually know of recently a lot of our health plans and other health plan foundations have really gotten more active and engaged with our hospital communities.
Mm-hmm.
A lot of our hospitals are starting to partner together in their CHNAs.
Mm-hmm.
And then an important question or, it could be a focus group question or survey question to ask that I've been asked and approached with is what organizations are currently doing any work to get to whatever the issue might be, like the priority issues.
Mm-hmm.
And so a lot of the hospitals are there, consultants working on the CHNAs are doing like a environmental scan of
Mm-hmm.
what CBOs or nonprofits are already trying to do that work. And then they reached out to like File for Health Men and said, we heard or someone informed us that y'all were doing work with hospitality workers. Tell us more about that. And so that opens up the dialogue for a hospital to see what CBOs are already doing stuff and have the capacity and then building a relationship there. So the CHNA, could be used again if you're asking the right questions about doing an environmental scan, could be used to inform those
Mm-hmm.
partnerships.
And what a great resource for both, too, the hospital and the community-based organization, because that organization is focusing directly on those needs. So really good connection there. And so transitioning a little bit, you've done great scaling of solutions in Louisiana, and we understand that that can be a challenge to scale some of the solutions like you have. So can you share a little about your new role at Louisiana Public Health Institute and the future for scaling up your work across Louisiana?
Sure. So I am coming to this new role with experience now of having worked at the
Mhm.
state level, federal level, and now grassroots level. And so with LPHI, this is a brand new position that they created from their equity journey, doing an equity audit and figuring out what they needed to do internally and externally. And so I feel like I'm one of those outcomes from their process, their equity process. Um, and so we are statewide. And I always try to have that perspective, as I just shared about, on the ground, what it feels like and looks like as a CBO.
Mhm.
But then knowing kind of the infrastructure and the struggle at the top or the grass tops with the state government, how the power and resources are kind of allocated, distributed, decisions are not made for what reason and how they're made. And so there's so much work, as you probably all know, like New Orleans is different from the rest of the state. Like there's a very
Mhm.
great disparity. And I seen there's somebody on the call from Baton Rouge, but there's a very great disparity between what happens in New Orleans and then what happens everywhere else.
Mhm.
And so New Orleans, there's a lot of innovative projects that's happening just in the area. That's like pilots. But our mission right now is to work in the rural areas to
Mhm.
kind of figure out how do we take some of those lessons learned or not and translate that to the rural areas. So when we're trying to scale up, it's really looking for some bright spots. There are bright spots happening across rural Louisiana. Figuring out what are those pieces that make it successful and then trying to like replicate that. Um, And then when it comes to sustainability, there needs to be, of course, power and resources.
Mhm.
I'm going to mention that a lot. So, how do you get the right people to know about what's happening for that investment? Because it takes lots of resources to do anything statewide.
Mhm.
And then again, going to that institution, organization who, strategically is best positioned to handle whatever the outcome or system you're trying to change. With my new role, my focus right now is really to get out of the public health silo. And so we have a million different coalitions set up for like tobacco. We have obesity. We have an asthma coalition. And of course, at the local level, all of these CBOs are probably part of 20 or 30 different coalitions with the same people.
Mm.
But I'm trying to break that silo and get us at the table or coalitions with those systems that are set up that keep um, our vulnerable population, like that's serving them. And so, for example, we should be at the table with education reform, looking at economic development. Because when we look at our health disparities data, it's always going to be low ICS, rural, African American. That's always our health, where our health disparities data points to.
Mhm.
And so if it's low SES, then we really need to be improving SES. We
Mhm.
need to be figuring out how we increasing economic development. And so over these last 6 weeks, we've already been invited to tables to talk about early childhood education, which helps with education and with economic development for the parents. They're now able to go to work. Um, I've been a Medicaid advocate for 15 years now. So really helping internal Medicaid program look at some of the reform efforts as far as requirements to elevate people out of poverty. How are we inspiring people to get off of the Medicaid program, providing those supports? Um, and also another, I guess, silo or system would be in the built environment. So doing a lot of work around housing, specifically in New Orleans right now, because there's such a major issue with housing, but taking that statewide for different, systems reform to ensure that everyone have safe housing, a roof over their head.
Mhm.
So for me, that is the new scale up that we're trying to do with public health, is get outside of our system and be at the table for the other systems.
Mhm. Yeah, that's a great point. And like focusing on where that power comes from and where that is needed and actually getting to the table. What advice do you have, or what has helped you get that foot in the door and have that seat at the table to have these
Yeah,
conversations with the
it's
systems?
it's interesting because it's been very easy,
Mm-hmm.
because I started having these conversations and I've heard things like, oh, we didn't have a healthcare person on this board or advisory. Would y'all want to be that? And so I guess it's just having intention and going, taking time to go and ask somebody.
Mm-hmm.
Because usually, though, what has happened is when we go and have those meetings or conversations, we're asking them to come to our coalition. We're asking the education groups to come advocate for smoke-free air, tobacco-free schools. It's less, we haven't gone to them and say, how can we help you
Mm-hmm.
with your efforts? And so that's how we're kind of trying to turn the table.
So really establishing those partnerships yourself at that system level.
Yes,
I really like
yes.
that. Great.
Yep.
Well, so when we talked briefly a few days ago, you mentioned a new project that you have starting as far as a grant goes. And can you describe what that is? And then I know you have an application out for community-based organizations. And I'm just kind of curious about maybe more specific descriptions of community-based organizations that you would hope to apply, and what you would hope they would do with some of that funding.
Sure. So LPHI received a Robert Wood Johnson Foundation grant earlier this year, and it's called, let's see, it's their building capacity to reduce tobacco inequities in the South and Midwest. So I know they have a lot of different grants out right now around
Mm-hmm.
racial justice that we're also
Yeah.
looking at. But this one was specifically around tobacco inequities. But their view and vision for this is that we align the goals to reduce tobacco use with the current social justice issues.
Mm-hmm.
And so LPHI has taken that grant, and we've developed a project called Project Assert. And Assert stands for Addressing Systemic Inequities to Reduce Tobacco Use. And our goal is to convene, organize, and house a learning collaborative of community-based organizations and rural clinics to build the capacity of Louisiana's rural communities to reduce tobacco use among African Americans in those rural communities. And so we have funding to do mini grants out. We've selected 10 communities based on the community health needs assessment. We looked at the data that shows who has high tobacco use, where's the most impoverished communities, and we selected 10 of those. And we are doing $20,000 mini grants to 10 organizations. We're going to try to find one community-based organization in each of those communities. And we're also doing a $7,000 mini grant program for the rural health clinics. That way they can be a part of the conversations when it comes to social justice, as well as providing the cessation services that's needed in those communities. With the CBO, so we just released the RFA on last Friday afternoon. We're hoping that we get applicants that could be churches. It could be Boys and Girls Clubs. There's a lot of very small nonprofits that are set up to kind of work with youth. And then hopefully there are some that are set up that are more civic organizations that are very interested in policy or mobilizing the community to get to a policy outcome. Mm-hmm. And we're calling it a learning collaborative because we're going to have this training plan where every month they're going to get doses of some type of topic training on a skill or topic. Some of them are very tobacco prevention and control focused, but many of them is just around what is advocacy? What does that look like? How do you talk to legislators? How do you do op-eds? In order to move that community towards some type of policy outcome. And Robert Wood Johnson is okay if that policy outcome is not a smoke-free air policy. Mm-hmm. It could be that the community really sees that COVID is a major priority and they want to focus on that first. So we're going to help them focus on that first and then figure out how can we also kind of plant seeds about tobacco prevention and control in the community.
That's interesting. So kind of taking that broad approach to improving those health outcomes. And I think it's really, really interesting to create those connections like with the churches, but then broadening it to the civic organizations so you can reach all aspects of the community and ways to improve those health outcomes. We'll look forward to continuing to stay in touch and learn more about how that continues to go. And I love the learning collaborative aspect too, because there's, I'm sure, so much that all of those organizations can learn from each other as well as LPHI. And so on this topic of health equity and improving health outcomes, my last question for you is just why is all of this important to you? Why is health equity important to you, your role? Why is this important to you?
So I thought about that question when you said it to me, and I feel like the simplest answer is to say I'm a Libra. I really, like, at my core and nature, like, have a thing about justice and equality. Mm-hmm. And so just knowing that there are systems set up on purpose to keep people down isn't fair to me. Mm-hmm. It's very unjust. You know, they were set up a long time ago. And so now it's time to transform and break those down and create something new. And so right now we have a great opportunity with a lot of systems that are breaking down, you know, naturally, organically, to ensure that when they're rebuilt, they're built so everyone can have advantage over it.
Mm-hmm. Absolutely. I completely agree. Well said. All right. Well, so now I would like to open it up for questions from participants. So if you have any questions for Tiffany, you can put those in the chat box, or feel free to raise your hand and come off mute. But I will go to some of the questions that we got in the registration as well. So we'll start off with one. This question says, how do you work to integrate community members into decision-making roles?
Um, so when I thought about this when you sent it to me too, thinking about the community, not every person in the community is a leader and can have that role. So be mindful of that. And then knowing when you are engaging with anyone in the community that it's usually very clear if you're authentic or not. And so it's best that you just start very transparent and ensuring that they know why you're even talking to them. Because sometimes it's like, why are you even talking to me right now? So being transparent from the beginning, what you're looking for, and then, ensuring that you are even, at an organizational level, having the right person have that conversation with the community, because sometimes it's all around about the messenger, and that messenger needs to be a trusted person and value the person on the other side. If you're sending somebody who doesn't even value the community, that's right there, you've taken the wrong path. So having the right messenger, going to the community with that authentic, transparent approach. And then again, it's for me, you have to strategize. So even before you sent that messenger, you know what you're trying to do. Because community members are very smart, and they can help you sometimes. Like, you can really avoid a lot of wasted time by just being open from the beginning. And I said, oh, you don't need to talk to me. You should go talk to this person. And there are a lot of community members who are natural leaders, and you just kind of got to sift through and find who those are to fit whatever your mission is. And then the final thing is going in knowing that it can't be all about you. So you really have to create a win-win relationship. And so when you're going out and saying, this is what I need, you also have to sit back and listen to what they need. Just like with our Robert Wood Johnson grant, we were asking in the RFA, what are your priorities? What are you working on? Because we're going to help you get to that too. So you have to create that win-win situation. And then again, as I said, at the community level, resources and power is lacking. And so if you are an organization who have power and resources, being open to connecting that person you're talking to with some of that. It has to be, shared, just redistributed.
Mm-hmm. Absolutely. And you may have already answered this a little bit, but it's just phrased differently, so what is the most effective way for leaders from a community outside, who may not have the same ethnicity or culture, how might they become engaged with communities that are different than them? And I'm thinking even more specifically for healthcare professionals or leaders in healthcare, what is the most effective way to make those connections and become engaged in communities?
Sure. And I'm going to say this from my own experience when I work for the state. There are communities I've never worked in before and never been to. My strategy was something that I've said before, is identifying that one person, that one connection.
Mm-hmm.
Like, I don't know anybody in that community, but I know that this person knows somebody, or just, individually being strategic, thinking about what connections you might have, because it's usually less than 6 degrees that you have there. And then talking with that person, and then creating that snowball. Who do you know? Do you know somebody? And then once you find a trusted community person, building that strong relationship with them. It might not even be about work. It's about work, but it might be on a more friendly basis.
Personal,
That way you can build that trust with them, because then it's then having a conversation. Okay, well, this is what I'm trying to do.
Mm-hmm.
How do you think I should do it? How do you think this organization should do it? And then you have, hopefully, because of those good trusted relationships, you have ambassadors now who are going back with word of mouth and saying, that's a really good person, you should
Mm-hmm.
trust them. And so that has been my strategy when I work for the state, because usually if we have like a meeting the Department of Health is putting on, people are like, rolling their eyes or like, what do they want? But if they know Tiffany's going to be there, because they're like, oh, I'll be there, what do you need? And so it really is all about relationships.
Mm-hmm. Yeah, and building that trust too. And so along those lines, do you have tips or things that have worked well for you to build trust with one single person that you find?
Um, Being real,
Yeah.
like, I mean,
Simple.
it might be a simple answer, but it's like, again, people know when you're coming to them for something. And
Yeah.
so you might as well in the beginning say what you're trying to do and why you're trying to do it.
Mm-hmm.
Because then they'll be able to relax a little bit, because they'll know that you're being honest and transparent. But when somebody's coming talk to you and you have no idea what they really want, it's like you're really weary about what information you're sharing.
Mm-hmm.
And the goal is to get the information or data, that way you can make decisions or move forward with a program or a project. And so for me, again, throughout all my roles, being a connector is like what I'm here for.
Mm-hmm.
And so trying to identify, okay, what are you good at? What's your assets? What do you bring to the table when I'm talking to like organizations? And then when I'm in the community, what is it that you need? How can we help you?
Yeah.
And then figuring out how to connect my network of professionals to what the community organizations or the community members need.
Mm-hmm.
And again, with building trust, as long as people, or you share with people that you're not just here to get something from them.
Yeah.
It can't just be, I'm here to get, I need this, I need that. You have to also be at the table with something to offer.
Mm-hmm. Great point. I see Libby's question, and Libby, you can feel free to come off mute too. But I'll read your question first. So Tiffany, if your work is a pie, how do you slice the key pieces of your efforts? So how much time do you spend in advocacy, policy, relationship building, etc.?
Great question, Libby. I can't give a number because every day is different. So I just try to have like my personal guiding principles to kind of fill it out. And I said I was a Libra, so everything is really about feelings and emotions. So
And
I just
balance.
go with my instincts. But usually, like when I close my eyes and kind of see everything mapping out, like everything in that pie is connected, and there's a strategy, and one might have to come before the other. And when it comes to like, to me, at the end of the line would be the policy work. At the very beginning is the authentic community engagement, because you have to figure out, what are you even trying to do when it comes to the policy work. And so it's the authentic community engagement, learning the community, figuring out what's needed, why are things the way they are. And then it's the education. Like sometimes it's just telling people what's happening at the state level, at the local level, or telling the state level people what's really happening at the community level. So it's that communication and education. And then it's building the capacity of whatever group you need to be those advocates, to have a voice, to be knowledgeable about how policy development really works. And then when it comes to policy, it's who has the power, who has the resources. So getting those people connected to those people. And so that's how I kind of do my work, just thinking about that all the time. What am I trying to do? Why I'm doing it? Yeah.
It definitely
That's
helps to
so
organize it that way. Yeah. Sorry, go ahead, Libby.
Oh, no, I'm so glad that you were able to come and join us today. And I know that you have so many things going on, but you've taught me so much in the brief few months that we've known each other. And that's just another pearl. Like for me, they are, all the pieces of the pie are connected. And at any given day, I totally get you that, you'll be all policy one day and all, but I've never quite heard it articulated, I guess it makes sense, but it really resonated with me when you just said, you really have to be in the community to understand the community, validate the community health needs assessment with the people, and then move to policy. I think there's so many times we try to go too fast to policy without to policy change because of a sense of urgency. I mean, we all know we need to change some things. And that sense of urgency, I think, sometimes makes me jump too quickly without doing those necessary steps in the community. That was really tangible. Thank you.
And just thinking about those policymakers, and I'll use legislators as an example of policymakers. They're not going to move on anything you have if you don't have community stories, or if you don't have a connection to someone in their jurisdiction, or if it's not something that they've personally experienced. So it's really important in our strategizing to get to a policy official that we have somebody from their community with us, if it's in another community, that we have their local data to show them so they have that personal emotional connection. Because they won't just take a policy brief with our data and change a policy. They have to be moved to do so. And so you have to do that background work.
Yeah, absolutely. And
that makes perfect sense.
It sounds like too, it's finding the right partners in all of this work as well. And one of the questions that came up through the registration was if you had any partnerships with community health workers.
Absolutely. And just a little bit of background. So my connection with community health workers have been from developing job descriptions of what a community health worker is, because about 5 years ago, we didn't have any standard job descriptions. And then figuring out how do we support that role as part of the workforce? Because hopefully, usually we're recruiting from the community, but they can't be seen or felt like an outside person outside of your system. Like if you're trying to hire a community health worker as for your hospital or community health center, they still have to feel like they're part of the care team or the team. They can't just be somebody sitting in the lobby with the community, because then they definitely feel that barrier. So really integrating them into the workforce, into your staffing, and a part of your teams. We do have a statewide coalition called the Louisiana, let's see, I wrote it down, Community Health Outreach Network. And so that is a coalition of community health workers who've gotten together to advocate for Medicaid reimbursements and that type of policy change. But from my role as an administrator, it's always about how do we set up community health workers field as any other field we would set up, making sure there's curriculum and capacity and they get credit for it. So working with some of our community colleges to make sure that they have accredited programs. How are we identifying community members? What type of person in the community, do we need? Setting up trainings for them. And then again, getting them acknowledged from the leadership of those organizations that they are a valued person, part of their team, has been kind of my role with community health workers. And then I've hired community health workers at 504 HealthNet. From the hospitality project, we actually identified a general manager of a restaurant who happened to like biology and healthcare. Wow. And so we recruited her to be our community health worker because she was a trusted source. She was from the community. She could speak to other hospitality workers. And so they are very important to our workforce when it comes to public health and healthcare, for sure.
Absolutely. What an incredible connection. Thank you for sharing that. All right. So at this point, we have a few minutes left, and I wanted to see if anyone else had any questions for Tiffany. Please feel free to come off of mute or put them in the chat. Connie, did you have a question?
Yes,
Hi.
I do. How do you start the conversation or dialogue with CBOs that are not historically very open or receptive to working with others that are different from them or believe differently?
So the first thing in that question is I would get to, how do you know they're not acceptable to work, open to working? Was it something you heard from your boss or somebody else? And so for me, that's just a conversation. That first conversation, it's being open to say, do you, like, I'm using my example of being a health department staff member, because I got that a lot, walking in around like, oh, you from the health department, what do you want? But trying to understand from that person or that organization, has something happened before? Like, I'm new here, so I didn't do you anything personally. Tell me about something that must have happened that got you to this place where you don't trust the health department. And so really getting to that first, because you cannot come in and say, I need this, I need that, I need that, without understanding what the history is first with that organization. And one thing I feel like is an asset for me, I guess, just staying in the Louisiana system, is I have 15 years now of why relationships are the way they are. Because we get a lot of new people coming in and saying, oh, I have a meeting with this person tomorrow. And I'll be like, hold up, let me tell you what happened with this person 10 years ago, So, because people don't forget. So that's the first thing, understanding why they have that feeling or perception about you, and then addressing it from the start. And then figuring out, maybe I shouldn't ask what I needed to ask this meeting. They might have to sit on this for a little while, or maybe I need to build a relationship and take this person to lunch first before I ask them or ask them to be on my, coalition or do something. So I would say relationship development,
That's what it all seems like, is building those relationships and establishing trust, which is kind of the fun part too, getting to know people.
Yeah,
And building that.
Thank you, Tiffany.
Thanks, Connie. There's another question in the chat from Charlene. So Tiffany, where do you see these concerns 20 or 30 years from now, and are you optimistic? And Charlene, maybe you could be more specific about what concerns you're referring to.
I might have mentioned lots of concerns.
I know. Charlene, if you could, you can come off mute and speak up. Yeah.
Yes. Excuse me. Can you hear me?
Yes.
Oh, good. My throat is a little scratchy. Well, I'm looking forward to the day when we are not concerned with any of the current concerns, such as racial inequality, healthcare inequality, any of these concerns, that we're really more focused on getting on with scientific discoveries, curing disease, and no matter where it may be. And that's my hope. That's because I am very optimistic. I'm looking forward to the day, as well as gender awareness. We don't need to be concerned that just because we're a female that we're going to be discriminated against. So it's all of that encompassed into one big lump question.
I gotta answer
that. Sorry.
You sure try.
Well, yeah. If you could just respond to the last question. Are you optimistic? Well, leave it at that.
I am very optimistic. It takes, unfortunately, in our society, it takes political will, and so until we could get political will to be the way you describe, it will constantly be tension and a struggle because of power and resources, right? Power and resources. So we have another initiative I just started, is to increase awareness and promote civic engagement as a social determinant of health. And so the more we get the power regarding civil engagement into our most vulnerable populations, the more we will hopefully change political will. And then a second idea I have around this question is, you mentioned, having cures for diseases and a better healthcare system. Another thing I'm just getting into now after 15 years is looking at natural health and wellness. And so there's so many things we can do to even prevent diseases. As the chronic disease director for the state, my role was to promote health and wellness or nutrition, exercise. But those messages do not get all the way. You hear the messages, but for some reason at the community level, even at the personal level, sometimes it doesn't resonate until you have the disease and like, now I need to go on a diet, now I need a personal trainer. But how do we really promote natural health and wellness prevention at the local personal level before we even have these chronic diseases? It's something I've been thinking about. So an example of a policy is to have, I think they're doing it in Scotland, or like a prescription to go walk in the woods, like that's natural and it's preventative and it helps with your stress. And so I'm looking into those natural policies like that.
I really like that. And I think we've seen a prescription to fruits and vegetables too from physicians, which I really believe that connection with our providers and the community-based organizations and health and well-being is so important as well. Lisa, I see your question in the chat, and I know we're right at time, but Tiffany, really quickly, Lisa, it looks like, had a doctor from the state tell her that patients at the facility were stupid because they were on Medicaid. How do you address such overt bias? That's another large question.
That doctor shouldn't be a doctor at the state. So first, how do you get that doctor removed? Because that's changing his values, beliefs, and attitudes, and we might not be able to do that. But that, it's getting this doctor away from his power and resources.
Power and resources, yep.
Like he has too much power and resources. And so that's my answer.
Yeah. It's a good answer and definitely a really good thread throughout this discussion. I've definitely taken a lot away from this and have learned so much from you, Tiffany. Any final thoughts from you on what's next?
I just appreciate connecting with y'all. Like that's my favorite part of my work, is having new friends and new networks. And so I appreciate the opportunity to talk to y'all today.
Well, we really appreciate you joining us. Honored to have you take the time to join us on your Friday afternoon. And thank you for all that you've shared. We look forward to continue to be in touch with you and continue to learn from your really important work. If there are any other questions for Tiffany, you can send them to my email and I can help make that connection. Other than that, thanks again so much, Tiffany. And I hope everyone has a wonderful rest of your Friday and a really, really great weekend. So thank you. Bye,
Enjoy
everyone.
your sun, because I don't have any right now.
I wish I could send some your way.
Bye.
Take care.